What is the basic unit of muscle called? Option A sarcomere, myofibril, actin, myosin. The right answer is sarcomere. The sarcomere is the basic unit of striated muscle tissue. Which joint is a hinge joint? Option A shoulder, option B elbow, option C hip, option D wrist. The right answer is elbow joint. The elbow joint allows movement in one plane like a hinge. What type of muscle fiber is fatigue resistant? Type 1, type 2A, type 2B, type 3. The right answer is type 1. The type 1 fibers are slow twitch and fatigue resistant. What is the primary function of the quadriceps? Option A flex the knee, extend the knee, rotate the hip, flex the hip. The right answer is extend the knee. The quadriceps extend the knee. Which bone is the longest in the human body? Option A femur, option B tibia, option C humerus, option D radius. The right answer is femur. The femur is the longest bone in the human body. What does the term biomechanics study? Option A muscles, option B movement, option C bones, option D nutrition. The right answer is movement. Biomechanics is the study of the movement mechanics. What which structures connect muscle to bones? Option A tendons, option B ligaments, option C cartilage, option D fascia. The right answer is tendons. Tendons attach muscles to bones. What is the function of the biceps brachii? Flex the elbow, extend the elbow, pronate the forearm, spinate the forearm. The bicep brachii flex the elbow and spinate the forearm. What is the main function of the deltoid muscle? Option A rotate the arm, abduct the arm, flex the arm, extend the arm. The right answer is abduct the arm. The deltoid abducts the arm at the shoulder joint. What type of joint is the shoulder? Option A hinge, option B ball and socket, option C pivot, option D gliding. The right answer is ball and socket. The shoulder is a ball and socket joint allowing extensive movement. What is the primary function of the rotator cuff muscle? Stabilize the shoulder, flex the shoulder, extend the shoulder, rotate the forearm. The right answer is stabilize the shoulder. The rotator cuff muscle stabilize the shoulder joint. What type of muscle contraction occurs when the muscle length? Concentric, isometric, eccentric, isotonic. The right answer is eccentric. Eccentric contraction involves muscle lengthening under tension. What is the role of ligaments? Connects bones to muscles, connects bones to bones, support internal organs, facilitate joint movement. The answer is connects bones to bones. Ligaments connects bones to other bones, providing joint stability. Which plane divides the body into left and right halves? Option A frontal, option B sagittal, option C transverse, option D coronal. The sagittal plane divides the body into left and right halves. What is the primary function of the hamstring? Flex the hip, extend the knee, flex the knee, rotate the knee. The right answer is flex the knee. The hamstrings flex the knee and extend the hip. Which muscle is known as the calf muscle? Gastrocnemius, soleus, tibialis anterior, peroneus longus. The right answer is gastrocnemius. The gastrocnemius is a commonly referred to as the calf muscle. What is the main function of the trapezius muscle? Elevate the scapula, rotate the shoulder, flex the neck, extend the arm. The right answer is elevate the scapula. The trapezius elevates, retracts, and rotates the scapula. Which joint is allow rotational movement? Option A hinge, ball and socket, pivot, gliding. The right answer is pivot. Pivot joint allows rotation such as the neck. What is the function of the abductor muscle of the hip? Option A flex the hip, extend the hip, abduct the hip, adduct the hip joint. The right answer is adduct the hip. The abductor muscle moves the leg away from the body midline. Which part of the brain is responsible for language comprehension? Broca's areas, Wernicke area, occipital lobe, parietal lobe. The right answer is Wernicke area. Wernicke area located in the temporal lobe is responsible for language comprehension. What is the primary function of the rectus abdominis? Rotate the torso, flex the spine, stabilize the pelvis, extend the spine. The right answer is flex the spine. The rectus abdominis flexes the spine. Which bone is part of the axial skeleton? Femur, humerus, skull, clavicle. The right answer is skull. The skull is a part of the axial skeleton. What is the primary function of the gluteus maximus? Flex the hip, abduct the thigh, extend the hip, rotate the thigh. The right answer is extend the hip. The gluteus maximus extend the hip. Which type of muscle is under voluntary control? Option A skeletal, smooth, cardiac, involuntary. The right answer is skeletal. Skeletal muscle is under voluntary control. What is the primary function of the pectoral major? Abduct the arm, extend the arm, abduct the arm, rotate the arm. The right answer is adduct the arm. The pectoral major adduct and rotate the arm. Which joint is an example of gliding joint? Option A hip, option B shoulder, option C ankle, option D carpal. The right answer is carpals. The carpals in the wrist are example of gliding joint. What is the main function of the latissimus dorsi? Option A abduct the arm, flex the arm, extend the arm, rotate the arm. The right answer is extend the arm. The latissimus dorsi extends the adducts and rotate the arm. Which structures cover the ends of bone in a joint? Option A ligament, tendon, cartilage, synovial fluid. The right answer is cartilage. Cartilage cover and protect the end of bones in joints. What is the primary function of the obliques? Option A flex the spine, rotate the torso, extend the spine, stabilize the pelvis. The right answer is rotate the torso. The obliques rotate the flex the torso. Which plane divides the body into interior and posterior parts? Option A sagittal, frontal, transverse, coronal. The right answer is frontal. The frontal plane divides the body into front and back halves. What type of muscle contraction maintains a constant muscle length? Concentric, eccentric, isometric, isotonic. The right answer is isometric. Isometric contraction maintain muscle length without movement. Which muscle group is located in the front of the thigh? Quadriceps, hamstring, adductors, abductors. The right answer is quadriceps. The quadriceps are located in the front of the thigh. What is the function of the tricep brachii? Flex the elbow, extend the elbow, rotate the arm, spinate the forearm. The right answer is extend the elbow. The tricep brachii extend the elbow. Which bone is part of the appendicular skeleton? Option A rib, option B skull, option C femur, option D sternum. The right answer is femur. The femur is part of the appendicular skeleton. What is the primary function of the erector spine? Option A flex the spine, rotate the torso, extend the spine, stabilize the pelvis. The right answer is extend the spine. The erector spine extend the spine. Which muscle is primarily involved in the plantar flexion of the foot? Option A tibialis anterior, gastrocnemius, soleus, peroneus longus. The right answer is soleus. The gastrocnemius and soleus muscle are involved in plantar flexion. What is the role of the meniscus and the knee joint? Option A provide stability, lubricate the joint, absorb shock, flex the knee. The right answer is absorb shock. The meniscus absorb shock and provide stability in the knee joint. What type of muscle fiber is sweated from short burst of power? Option A type 1, type 2A, type 3B, type 3. The right answer is type 2B. Type 2B fiber are fast twitch and suited for short burst of power. What is the primary function of the rhomboids? Option A elevate the scapula. Option B retract the scapula, rotate the scapula, depress the scapula. The right answer is retract the scapula. The rhomboids retract the scapula. What type of joint is the hip? Option A hinge, option B ball and socket, option C pivot, option D gliding. The right answer is ball and socket. The hip is a ball and socket joint allowing extensive movement. What is the main function of the iliopsoas muscle? Extend the hip, abduct the thigh, flex the hip, rotate the thigh. The right answer is flex the hip. The iliopsoas is a primarily hip flexor. Which bone is located in the upper arm? Option A radius, ulna, humerus, scapula. The right answer is humerus. The humerus is the bone of the upper arm. What is the primary function of the external obliques? Option A flex the spine, rotate the torso, extend the spine, stabilize the pelvis. The right answer is rotate the torso. The external obliques rotate and flex the torso. What is the role of the synovial fluid in joints? Nourish the cartilage, stabilize the joint, absorb shock, provide lubrication. The right answer is provide lubrication. Synovial fluid lubricates joint and nourishes cartilage. What is the primary function of the tibialis anterior? Dorsiflex the foot, plantar flex the foot, invert the foot, evert the foot. The right answer is dorsiflex the foot. The tibialis anterior is responsible for dorsiflexion of the foot. Which muscle is involved in shoulder abduction? Deltoid, bicep brachii, tricep brachii, pectoral major. The right answer is deltoid. The deltoid muscle abducts the shoulder. What is the main function of the abductor muscle? Option A, flex the hip, extend the hip, adduct the thigh, abduct the thigh. The right answer is adduct the thigh. The adductor muscle brings the leg towards the body midline. Which structures protect the brain? Option A, skull. Option B, vertebrae. Option C, sternum. Option D, clavicle. The right answer is skull. The skull encases and protects the brain. What type of joint is found at the base of the human thumb? Option A, hinge. Option B, ball and socket. Option C, saddle. Option D, pivot. The right answer is saddle. The thumb has a saddle joint allowing a range of movements. What is the primary function of the sartorius muscle? Option A, flex the hip, extend the knee, abduct the thigh, rotate the thigh. The right answer is flex the hip. The sartorius flex, abducts and rotates the thigh. Which muscle is responsible for wrist flexion? Extensor carpi radius, flexor carpi radius, branchiordials, prontoters. The right answer is extensor carpi radius. The flexor carpi radial is responsible for wrist flexion. What is the primary function of the supraspinatus muscle? Abduct the arm, rotate the arm, flex the shoulder, extend the shoulder. The right answer is abduct the arm. The supraspinatus abduct the arm and is part of the rotator cuff. What is the role of the acetabulum in the hip joint? Attach ligament, support muscle, accommodate the femur head, facilitate movement. The right answer is the acetabulum is the socket in the hip bone that accommodates the femoral. Which bone is commonly known as the collarbone? Option A, scapula, clavicle, sternum, humerus. The right answer is clavicle. The clavicle is commonly referred to as the collarbone. What is the function of the serratus interior? Option A, elevate the scapula, retract the scapula, protract the scapula, rotate the scapula. The right answer is protract the scapula. The serratus interior protract the scapula. Which joint type allows for the greatest range of motion? Option A, hinge. Option B, ball and socket. Option C, pivot. Option D, saddle. The right answer is ball and socket. Ball and socket joint allows the greatest range of motion. What is the primary function of the sternocleidomastoid? Flex the neck, extend the neck, rotate the arm, stabilize the shoulder. The sternocleidomastoid flex and rotate the neck. Which muscle is primarily mover in the pull-up? Option A, bicep brachii, trapezius, latissimus dorsi, deltoid. The right answer is latissimus dorsi. The latissimus dorsi is the primarily mover in a pull-up. What is the function of the Achilles tendon? Connect the calf muscle to the heel bone, stabilize the knee joint, flex the foot, extend the foot. The right answer is the Achilles tendon connect the calf muscle to the heel bone. Which bone forms the upper part of the nasal septum? Ethmoid, maxilla, humor, sphenoid. The right answer is ethmoid. The ethmoid bone forms the upper part of the nasal septum. What is the primary function of the levator scapula? Elevate the scapula, retract the scapula, depress the scapula, rotate the scapula. The right answer is elevate the scapula. The levator scapulae elevate the scapula. Which muscle is involved in plantar flexion of the foot? Tibialis anterior, soleus, extensor, digitorum longus, preunus brevis. The right answer is soleus. The soleus and gastrocnemius muscle are involved in plantar flexion. What is the main function of the rectus femoris? Flex the hip, extend the knee, flex the knee, abduct the thigh. The right answer is extend the knee. The rectus femoris flex the hip and extend the knee. Which muscle is part of the quadriceps group? Option A, bicep femoris, semitendons, vastus lateralis, sartorius. The right answer is vastus lateralis. The vastus lateralis is part of the quadriceps group. What is the primary function of infraspinatus muscle? Option A, abduct the arm, flex the arm, rotate the arm, extend the arm. The right answer is rotate the arm. The infraspinatus rotates the arm laterally. Which bone is part of the axial skeleton? Option A, femur. Option B, clavicle. Option C, vertebrae. Option D, scapula. The right answer is vertebra. Vertebrae are part of the axial skeleton. What is the function of the pectoralis minor? Option A, abduct the arm, depress the scapula, flex the shoulder, extend the shoulder. The right answer is depress the scapula. The pectoralis minor depresses the scapula. What type of muscle fiber is most resistant to fatigue? Type 1, type 2A, type 2B, type 3. The right answer is type 1. Type 1 fibers are slow twitch and highly resistant to fatigue. Which joint is an example of a pivot joint? Option A, hip. Option B, knee. Option C, elbow. Option D, neck. The right answer is neck. The neck between the first and second vertebrae has a pivot joint. What is the primary function of the crocobranchials? Option A, flex the shoulder, extend the shoulder, rotate the arm, abduct the arm. The right answer is flex the shoulder. The crocobranchials flex the shoulder. Which bone is commonly known as the kneecap? Option A, femur. Option B, patella. Option C, tibia. Option D, fibula. The right answer is patella. The patella is commonly referred to as the kneecap. What is the main function of the gluteus medius? Option A, flex the hip. Option B, extend the hip. Abduct the thigh, adduct the thigh. The right answer is abduct the thigh. The gluteus medius abduct the thigh. What is the role of the annulus fibrous in intervertebral discs? Option A, provide flexibility, absorb shock, attach muscle, protect nerves. The right answer is provide flexibility. The annulus fibrous provides structural support and flexibility to the disc. Which muscle is primarily involved in the extending the elbow? Option A, bicep brachii, branchials, tricep brachii, aniconus. Tricep brachii. The tricep brachii extend the elbow. What is the primary function of the soleus muscle? Dorsiflex the foot, plantar flex the foot, invert the foot, evert the foot. Right answer is plantar flex the foot. The soleus muscle involved in plantar flexion of the foot. Which muscle is located in the lower leg? Quadriceps, hamstring, gastrocnemius, latissimus dorsi. The right answer is gastrocnemius. The gastrocnemius is located in the lower leg. What is the function of the cruciate ligament in the knee? Option A, provide stability, flex the knee, extend the knee, rotate the knee. The right answer is provide the stability. The cruciate ligament provides stability to the knee joint. Which type of joint is found in the wrist? Option A, hinge. Option B, ball and socket. Option C, gliding. Option D, pivot. The right answer is gliding. The wrist contains gliding joints. What is the primary function of the adductor longus? Option A, flex the hip. Option B, abduct the thigh. Option C, adduct the thigh, extend the knee. The right answer is adduct the thigh. The adductor longus adduct the thigh. Which muscle is involved in elbow flexion? Option A, bicep brachii, tricep brachii, deltoid, pectoralis major. The right answer is bicep brachii. The biceps brachii flex the elbow. What is the role of the synovial membrane in a joint? Option A, produce synovial fluid, absorb shock, attach ligament, support muscle. The right answer is produce synovial fluid. The synovial fluid membrane produces synovial fluid which lubricates the joint. Which bone is located in the forearm? Option A, humerus. Option D, option B, radius. Option C, femoris. Option D, scapula. The right answer is radius. The radius is one of the two bones in the forearm. What is the primary function of the teres major? Option A, flex the arm, extend the arm, abduct the arm, rotate the arm. The right answer is extend the arm. The teres major extend and rotate the arm. Which muscle is part of the hamstring group? Option A, rectus femoris, vastus medialis. Option C, semimembranous. Option D, sartorius. The semimembranous is part of the hamstring group. What type of joint is the ankle? Option A, hinge. Option B, ball and socket. Option C, pivot. Option D, gliding. The right answer is hinge. The ankle is a hinge joint. What is the primary function of peroneus longus? Option A, dorsiflex the foot, invert the foot, plantar flex the foot, evert the foot. The right answer is evert the foot. The peroneus longus evert and plantar flex the foot. Which structure separates the chest cavity from the abdominal cavity? Option A, rib cage. Option B, diaphragm. Option C, sternum. Option D, clavicle. The right answer is diaphragm. The diaphragm separates the chest and abdominal cavities. What is the main function of the bronchioridals? Option A, flex the elbow. Option B, extend the elbow, pronate the forearm, spinate the forearm. The right answer is flex the elbow. The bronchioridals flex the elbow. Which muscle is primarily responsible for shoulder elevation? Option A, latissimus dorsi. Option B, pectoralis major. Option C, trapezius. Option D, deltoid. The right answer is trapezius. The trapezius is involved in shoulder elevation. What is the primary function of the popliteus muscle? Option A, extend the knee, flex the knee, rotate the thigh, stabilize the hip. The right answer is flex the knee. The popliteus flex and rotates the knee. Which bone is part of the shoulder girdle? Option A femur, option B humerus, option C scapula, option D tibia. The right answer is scapula. The scapula is part of the shoulder girdle. What is the role of the intervertebral discs? Option A connects vertebrae. Option B protect spinal cord, absorb shock, facilitate movement. The right answer is absorb shock. Intervertebral disc absorb shock and provide cushioning between vertebrae. What is the primary function of the flexor digitorum longus? Option A flex the toes, extend the toes, dorsiflex the foot, plantar flex the foot. The right answer is flex the toes. The flexor digitorum longus flex the toes. Which bone is part of the thoracic cage? Option A clavicle, option B scapula, option C sternum, option D humerus. The right answer is sternum. The sternum is part of the thoracic cage. What is the main function of the branchies? Option A flex the elbow, option B extend the elbow, option C pronate the forearm, spinate the forearm. The right answer is flex the elbow. The branchials flex the elbow. Which muscle is involved in knee extension? Option A hamstring, option B gluteus maximus, option C quadriceps, option D gastrocnemius. The right answer is quadriceps. The quadriceps extend the knee. What is the primary function of the tibialis posterior? Option A dorsiflex the foot, plantar flex the foot, invert the foot, evert the foot. The right answer is evert the foot. The tibialis posterior invert and plantar flex the foot. Which bone is commonly known as the shoulder blade? Option A clavicle, option B scapula, option C sternum, option D humerus. The right answer is scapula. The scapula is commonly known as the shoulder blade. What is the function of the lateral collateral ligament in the knee? Option A stabilize the knee, flex the knee, extend the knee, rotate the knee. The right answer is stabilize the knee. The lateral collateral ligament stabilize the knee joint. What is the primary function of the abductor pollicis longus? Option A flex the thumb, option B extend the thumb, option C abduct the thumb, adduct the thumb. The right answer is abduct the thumb. The abductor pollicis longus abduct the thumb.